Treatment for antisynthetase, again, depends on what symptoms the patient has, what organ systems are affected. In general, all the treatments we're giving a patient are lowering their immune system. So recall, we believe that this syndrome is caused by an overactive immune system. For reasons we don't quite understand, the immune system is attacking the muscle, it's attacking the lung, it's attacking the joints. So we need to calm it down. And there are a number of medications we use to do that. Most patients will be familiar with things like steroids, which is a type of chemical that we put into the body. Prednisone is another name for it, corticosteroids. There are a lot of different types of steroids that patients can receive, but most patients will be at some point on steroids. Other medications include things like methotrexate, azathioprine, mycophenolate, rituximab. There are actually several medications that we have, and all can be very effective at treating patients, again, depending on what they have. For instance, if a patient has a lot of joint disease, it's very common for them to be on things like methotrexate or azathioprine. If a patient has a lot of lung disease, it's common for them to be on mycophenolate or azathioprine. So there is some overlap, if you kind of envision the Venn diagram of certain medications for certain symptoms, but for the most part, it's important to know what's affected so we can kind of target that as much as possible with the medications we use. One thing patients should be aware of is these medications take a while to work. So it's very different than taking a Tylenol, taking an aspirin, where you take it and expect an effect in 4 to 6 hours. These medications do not work that way. They take a long time to kind of build up in the body, achieve a steady state, and actually exert their effect. So upwards of 2 to 3 months, and sometimes even longer, these medications can take to have their full effect. So patients shouldn't be discouraged or demoralized after a couple weeks when they don't really feel like they're having a response, because it can take a little bit of time. The exception to that is steroids. They usually see a sooner response with steroids. As most patients know, steroids has a lot of side effects the longer you're on them. So while they're helpful up front and usually are used early in the diagnosis, we try to get them low, if not off, as soon as possible in all of our patients. Most patients will need to stay on their medications for at least a few years. It varies greatly depending on the patients, but some patients will need to be on these medications for their life. Other patients are able to come down in the dose of the medication they're on over a few years and even be on very low doses, or a small group of patients will even be able to be totally discontinued. Unfortunately, we don't know which patients will be the ones that are able to come down on their medications or just simply discontinue them over time. But studies are underway to address that very question. Another thing patients should be aware of is that when they're on these types of medications, these immunosuppressing medications, they're going to need to get monitoring blood work. And this blood work is done just to make sure the patient's tolerating the medication okay and doesn't have any signs of toxicity. So depending on the medication, that kind of dictates what its side effects are, but in general, blood work will be required. When we start the medications, we tend to check blood work a little more frequently, just because it's a new medication, we're increasing the dose over time, we want to make sure they're doing okay. So usually every few weeks or so, we'll get blood work. However, once a patient's on a medication that's steady, they've been tolerating it for a few months now, they can space out the frequency of blood work for every 3 months or so. It's an average interval which we go with. We also encourage patients to receive vaccinations, and they can receive those vaccinations, at least specific vaccinations, even if they're already on immunosuppressing medications. So the two we recommend is a yearly flu shot, as well as a pneumonia vaccine. And to get a little bit more information as to who and when, we actually have a video for vaccinations that you can reference, and you can look at that after this video completes.